Hello, my name is Rupak Shivakoti. I'm an assistant professor of epidemiology at Columbia University, Mailman School of Public Health. My research focuses on how inflammation and microbiome affects disease outcomes, especially at the nexus of infectious and chronic diseases. For example, we see that individuals with TB, another respiratory infection, those with concurrent diabetes, so that also have diabetes, tend to have increased inflammation and worse outcomes. This has now also been observed for COVID-19, where individuals with diabetes have higher rates of severe symptoms as well as mortality compared to individuals without diabetes. So the role of diabetes in COVID-19 is what I wanted to briefly talk about today. Individuals that have well-controlled diabetes tend to do better than individuals that have not controlled their blood sugar levels as well. So of note to the younger population here, some of the recent data suggest that even younger people with comorbidities like diabetes have a higher risk of adverse outcomes with COVID-19. Despite this, there are a lot of unknowns regarding diabetes and COVID-19. For example, whether diabetes itself leads to worse outcomes or if it is actually another comorbidity that is also present in the same patients is not as clear at this moment. For example, those with diabetes also tend to be obese or also have other cardiovascular diseases. So is it diabetes itself or is it one of those other comorbidities is not absolutely clear at this point. And even if diabetes is directly leading to worse outcomes and more mortality, we still do not know the biology behind it. For example, there is increased inflammation in diabetics. And even more so, there's even more inflammation in poorly controlled diabetes, and this is thought to be a contributor. And we know this is a contributor, for example, for TB, but it needs to be studied further and confirmed in the context of COVID-19. And finally, we also don't know the contribution of various diabetes medicines. For example, metformin, one of the diabetes medicine, has an anti-inflammatory role. So do people on metformin tend to do better than those that are not on metformin-based medications? So ultimately, there are a few unknowns at this moment, but what is clear is that this population, those with diabetes, are at an increased risk of adverse outcomes, and this is true even for younger people. So if you are a diabetic or know someone with diabetes in your life, this is an important point to note. So that's what I wanted to say. Take care, everyone, and thank you.